My name is Alex Small. I'm a fourth-year medical student at Mount Sinai School of Medicine in New York City. I'm doing a one-year-long Doris Duke Research Fellowship, and this is one of the projects I've worked on this year. For this project, we were interested in looking at the prevalence and characteristics of patients who present with stage 4 metastatic prostate cancer and never receive any anti-cancer therapy. Now that includes hormones, chemotherapy, radiation, surgery. These are basically patients that come to their doctor for the first time with bone pain or urinary tract symptoms for whatever reason, and the doctor finds that they have stage 4 prostate cancer. But due to a variety of factors, be it patient preference, physician preference, poor patient functional status, these patients are not eligible or choose not to receive any sort of treatment. So we were interested in describing the characteristics of this population. So between 2000 and 2008, using the National Cancer Database, which is a hospital-based cancer registry that encompasses over 75% of new cancer cases in the U.S., we found that there were 1,200,000 cases of prostate cancer. Of those cases, 59,000 were patients with de novo or new stage 4 prostate cancer. And of those, a small fraction, a small but real fraction, 6,582 patients, or about 11%, received no treatment whatsoever. Now, looking at the prevalence of the untreated versus treated groups, we saw that with every 10 years of increasing age, the prevalence of being untreated increased by 1.43 times, or 43% increase. Black and Hispanic patients were 30 and 40% more likely to fall into this category. Patients who lived in areas with a lower income or areas with less education overall were more likely to fall into this category. And patients with no insurance, Medicaid, or surprisingly Medicare were also likely to fall into this category. So my graphs here are just showing the increasing prevalence of being untreated as age goes up, as area where you live, the income goes down, and the educational status goes down. So this is an important observation because these patients are basically falling through the cracks. So we don't have certain limitations with the database. We have no outcome data, so we don't know specifically how they died. We can't do multivariate analysis because it's aggregate data. But overall, it is hypothesis generating and looking at some potential disparities in the screening and treatment of prostate cancer.